MTP Act 2021, there is a medical termination of pregnancy. So firstly, looking at the indications, it can be due to therapeutic, that is to save life of the mother, and it can be eugenic. Eugenic is basically to prevent the risk of the child being born with the serious mental or physical abnormalities. And this can include the first trimester viral infections as well as the teratogenic drugs and the radiation exposure. Then also the humanitarian. Humanitarian is in case of the rape or incest. Next, social. Social would be due to from failure of contraceptives. Now, what are the rules of the MTP? The rules includes rules. So basically, an RMP, that is a registered medical practitioner who is qualified, can terminate pregnancy. So qualified is nothing but the one who has assisted in performance of 25 cases. So who has performed at least 25 cases of the MTP, and this is in a recognized hospital. Then we are looking at the MTP that should be carried out. That it should be carried out in a government as well as in a government recognized hospital. The private hospitals may take up MTP if they obtain a license from the chief medical officer. CMO of the district should allow the performance of MTP. This is from for the private hospital. Next, the termination of pregnancy by a person who is not a registered medical practitioner or unrecognized hospital. So the punishment in such case, in case there is an issue with the hospital, as well as if the medical practitioner is illegally performing. So in such cases, the punishment will lead to rigorous imprisonment, and the term should be greater than 2 years. So at least 2 years, there will be a jail sentence, but which it may extend up to 7 years. So next, the consent is obviously taken. The consent of the women is required for conducting an abortion. So consent is taken. A written consent of the guardian is required if the woman is a minor. So also the written consent is taken in case of minor. This is by the guardian and it is taken. And the consent of the husband or the partner is not necessary. This is a very important point. The consent of the husband as well as the partner is not needed. Then in case the woman is not willing, abortion cannot be performed. If woman is not willing, then no abortion is not performed. At the request of the husband alone also, it is not performed. The woman need not produce proof for her age. This is also important. Women, no proof for age required. And it is enough for the woman to say that she was raped, and it is not necessary that a complaint be lodged in a court. So there is no need of police complaint. No police complaint is required. So now looking at the opinion of doctors. So in case of the opinion, so till 20 weeks, about 20 weeks, there is one doctor opinion is required, and about 20 to 24 weeks, there is a 2 doctors opinion is required. And in case of substantial fetal anomalies, approval from the medical board. So in case of substantial fetal anomalies, so this is the medical board is advised approval of the medical board, and this contains the obstetrician, the pediatrician, the radiologist, and also a person. This is appointed by the state. So the obstetrician, pediatrics, radiologist, and the person appointed by the state. Now looking at the upper limit of the MTP. So here there is up to 24 weeks of gestation in victims of rape. So it is up to 24 weeks. Up to 24 weeks in case of victims of rape and the incest, fetal anomalies, and the congenital malformation. So it is up to 20 weeks This is in case of the contraception failure. And next, in terms of any gestational age. So this is for the substantial fetal anomalies. So this should be approved by the medical board. So this medical board, as discussed earlier, it contains the obstetrician, it contains the pediatrics, it contains the radiologist, it contains the person who is appointed by the state. Now, how is the confidentiality kept? So basically, the confidentiality is a registered recording. Basically, a register is kept for recording the MTP. For at least 5 years, records are maintained, and the patient's name must not be entered. So there is no name entry, and only a reference number is used. There is a reference number which is used, and unlawful disclosure of the patient's details is punishable. So in case you disclose name, so in such cases there is punishable with 1 year imprisonment, 1 year imprison, as well as they can be fined, that is sent.